Unfortunately, sexually transmitted diseases are a part of what we see on a regular basis in our office. Common STDs that really bring a lot of anxiety and expected anxiety to the patient would be herpes. Genital herpes is a very common STD. 1 in 4 to 5 people have genital herpes, and unfortunately most of the folks with genital herpes are not aware they've had genital herpes, and this virus is getting passed around because there can be an asymptomatic nature to the virus until one of the partners becomes symptomatic, and symptoms can range from anything from vaginal itching to little genital sores, and it's something that we've now included in part of our STD screening packages to see if you are at risk or have been exposed to the virus in the past. So genital herpes is a big one. The other big one we still see is chlamydia. Chlamydia is a bacterial infection that spreads sexually. Gonorrhea is a bacterial infection that spreads sexually, and those two things we test for routinely if you're 25 or younger in the practice, or if you come in for a general STD panel. Those diseases, the bacterial illnesses, can be treated effectively with antibiotics, unlike genital herpes, which is more of a lifelong disease that we tend to try to suppress or keep under control. Another common STD, and I hate to think of this as an STD because it's so common in the population, would be human papillomavirus. We all know there's the human papillomavirus vaccine that we recommend all people 26 years old down to 12 years old get to help reduce the risk of HPV infection, which is linked to genital warts, abnormal pap smears. So when I think of common STDs, I think of chlamydia, gonorrhea, herpes, HPV. Of course, there are always other ones out there. We always need to never forget about HIV, never forget about syphilis. These obviously are out there, but they're a little bit less common in our patient population. If you're interested in STD testing or prevention, you're welcome to make a consult visit to discuss this. Thank you very much.